Have you been having difficulty breathing, experiencing shortness of breath, or having chronic asthma attacks, emphysema, or bronchitis?
Theophylline is the drug for you.
Theophylline is also referred to as phyllocontin, theochrone, and unifil.
Do you know why you should use theophylline?
Theophylline is a bronchodilator. It relaxes the smooth muscles in your respiratory system and increases pulmonary blood flow.
Theophylline can be used by anyone: infants, neonates older than 6 weeks, children, adolescents, and adults.
Theophylline can be used for bronchial asthma, bronchial spasm associated with chronic bronchitis, emphysema, apnea during infancy, and for respiratory or myocardial stimulation.
Theophylline comes in many forms. Take it orally, have an IV continuous infusion, or rectally.
Prior to taking theophylline, check your theophylline blood levels and that it is within the therapeutic level of 10 to 20 micrograms per milliliter. Monitor your intake and output, check results of your liver function tests, assess your respiratory rate, rhythm, and depth, and monitor allergic reaction and beers.
You should experience a therapeutic response of decreased shortness of breath, respiratory stimulation, and clear breath sounds within a couple of hours.
Theophylline does not work right away and should not be used for relief of an acute asthma attack. For example, theophylline maintains therapy for asthma and COPD, treats methotrexate toxicity, reverses airway obstruction, and decreases shortness of breath.
Do not take theophylline if you experience hypersensitivity to xanthines or experience tachydysrhythmias. Consult your doctor if you are pregnant, breastfeeding, have congestive heart failure, or cold pulmonale, hepatic disease, diabetes mellitus, hyperthyroidism, hypertension, seizure disorder, irritation of the rectum or lower colon, alcoholism, or have active peptic ulcer disease.
Use with precaution in children and older adults. Toxicity levels may vary. Remember to take theophylline as prescribed. Check with your doctor about taking over-the-counter medications. Avoid alcohol, caffeine products, smoking, taking with food, and hazardous activities. Notify prescriber immediately about toxicity.
If GI upset occurs, take with water. Increase fluid intake to 2 liters per day to help clear your lungs.
Serious side effects may include GI upset, nausea, vomiting, palpitations, dizziness, sinus tachycardia, seizures, and dysrhythmias.
See your doctor about getting theophylline today.